Good one.
Your neck does not like to bend to the right. Your neck, oh yeah. Oh no. Oh yeah. That was nice. Go chin up. Okay, all right.
Wow.
It's like something from Star Wars. Bring balance to the force. Bring balance to the spine. See how it's pouring out of that spot, right? That's the epicenter. He's off to the races.
I can't wait.
What's it? Left.
Oh, yeah.
Oh, man,
that was
right
awesome.
side.
That was amazing.
All right, Rich, tell me about yourself. I know we got a couple MRIs here. Tell me your story. What's going on?
But I used to have headaches as a kid, and it sort of just developed into this like severe neck problem. About 3 years ago is when it got really bad.
Okay.
And I just, like, it was like 10 out of 10 pain all the way through my head.
Okay.
And about 2 to 3 years ago, the pain just started traveling all the way down my back. And it was like my body's like, oh, I'm giving up on you now.
Okay.
And it's kind of just locked in this like bad pattern here. So
Mostly in your neck. Do you feel symptoms down your arms?
it's a little bit, not, it doesn't really tingle all the way. It did a little bit for a short period of time, but as
More shoulder and elbow?
Yeah. It tingled down in my hand for a short period of time.
Gotcha. Yeah, it should be the, 1 second, 2, 3, 4, 5. So they took, who took these MRIs? What sort of led to the MRIs getting taken?
I complained to my doctor.
Uh-huh.
They sent me to the orthopedic surgeon, and I did physical therapy. When that didn't work, then they took pictures of it.
Okay, so when and you said they didn't go over your MRIs, or they did? What did they say?
They basically just said that you could have this and not have pain.
Okay, that was the gist of it.
That was it.
That's
All
all
right.
they said to you?
Pretty much. They were like standing in the way of treating me.
Okay, well, did they show you the images? Did you actually see these?
Yes.
Okay, all right, so this is, come over here, Carl, I got it right there. So this is your neck, you're looking to our left, so your
Yeah.
jaw would be, there's your jaw and your mouth over here on our left side. I'm zooming in a little bit. So these are the little spinuses, these little gray things, those little bumps that you feel in the back of your neck. Those are the spinuses of the vertebrae. What we're looking at here are these are the vertebral bodies, and then these in between there are sandwiched these discs that are made of cartilage, made of water. And so the cartilage, specifically here at the the C5 disc is going to hit the C6 nerve. The C6 nerve goes to your thumb and index finger. And so pressure here is going to give you, like you were saying earlier, tingling or some sensation down to your arm. Now, at the same time when the disc is injured, very likely the joints and the tissue above here is going to be inflamed, along with what we can see on the MRI, which is that there's disc injury. There's hypermobility here that's allowed this to be injured. Essentially, you're bending too much here, and that's what's allowed this to be injured. And you're not bending up here because these are not aging, right? So part of your neck has remained young, and part of your neck is aging at a faster rate. So essentially, you're 35, but your lower neck is 65. This is older than you are, and you're hitting the nerves in your lower neck, and we want to move the stress off of your lower neck, bring it back to where your neck is supposed to be moving, which is up at the top. Headaches are ultimately, one of the primary causes are inflammation in your upper neck. So because this is stiff, which allows this to be overstressed, this is all congested and clogged. There's nerves up here that get irritated. That's what then causes the headaches. So we'll go through your upper neck, get that moving properly for you. Headaches wouldn't be something typically, unless there's something more serious that you're going to be able to visualize on an MRI. You're saying it's more soft tissue, inflammation, tension, muscular, joint. What we can see in there is the more expensive things called discs. All back surgery ultimately happens because these discs wear out. They're non-sensitive, non-regenerative tissue that as it ages, we can't unage it. We can't turn back the clock. So the goal with even treatment of your neck is to slow the aging of that one disc so that you catch up to it. The path that you're on, by the time you're 50, it's going to be 100. And I can't even, I'm dropping things because I have weakness in my hand. And so we need to stop this train because it's going to derail. The lower back tells a similar story. So the white is water. So I'm going to start here at the top. So this is lumbar 5. There's 5 lumbar vertebrae. These are the discs here. And these all look brand new, healthy. They're all nice and filled with water. You know, there's no disc material going past the back of the vertebrae. And then you get to the last guy here, and it's like a piece of bacon, right? It's all cooked. It actually reminds me of bacon. It's like cartilage. It's like you've been inflaming this disc for so long, you've been cooking it, that it's actually getting harder and it's getting smaller. So the largest disc in your spine is supposed to be that guy. It's supposed to be bigger than that. They're supposed to get bigger as you go down. So it's what? You've lost 20, 30% of the height of that disc relative to that makes sense? And now there is material starting to come out. See that little?
Oh, yeah.
That's material coming out the back side. So like a jelly donut, you're squeezing the front, and then it all starts to herniate posteriorly towards the spinal cord. So your nervous system is right here. This is your spinal cord. This is cerebral spinal fluid that nourishes your spinal cord, and it's going down we call the spinal canal. So there's another word we use called retrolisthesis. So the back of the vertebrae should all be lined up. Let's go back up here to the normal areas. So that the corner of that vertebrae perfectly lines up with the corner. You see all that? Mm-hmm. They all line up. They're all supposed to be perfectly like Legos, stacked. So let's move down here. Lines up. So the back of that vertebrae doesn't line up. It's a minimal, about I call it grade 1 or maybe almost grade 1 retrolisthesis. So it's a very minor. That's what's actually damaging the disc. There's actually a sliding force being placed on that disc. Can you see that? If I run a line up the back of that vertebrae, I get to about there. Sorry, I'm zooming in again. And so there's a ligament in here that's been torn that allowed that to slide. And so discs are like that rubber eraser that you had when you were a kid, right? The rubber eraser, I could throw it in a parking lot and drive over it. It doesn't get damaged, right? But I could take that rubber eraser and twist it in my hands and rip it in half. So it can handle thousands of pounds of compressive force, but it can't handle 15 pounds of rotational twisting force. The discs can handle compressive forces. They can't handle shearing forces, sliding forces. And that's what's allowed. This is where you've had a whiplash or a fall, something, a fall into your butt that's torn that ligament and that allowed that sliding force to be placed on there. The symptoms of this would be, and you may not have symptoms of this yet, they would be leg symptoms. They would be symptoms of, Ed, my leg feels heavy, could be burning, could be neuritis.
I have some burning, yeah.
How long has that been going on? Years?
A couple of years.
So what I'm trying to say is that when this starts to hit something, it's like the enamel on your teeth. It protects the tooth, right? And the enamel is non-sensitive. The disc actually has no feeling. It prevents pressure on the structures that do have feeling. So as that disc doesn't do its job, as it gets worn out, the structures that have feeling start to get pressured, the nerves that go down your leg. We're going to loosen up further the parts of your back that are young, and they've remained young because you must not be accessing them. Meaning that when you bend, this must not be bending, hence why it's not aging. And if I had the MRI report on this, I would suspect they would say unremarkable in reference to the young parts of your back. It isn't unremarkable that some of your spine hasn't aged. It's actually quite remarkable, and that will give you the explanation for why this is aging too quickly, because this is not aging at all. We're doing about an inch forward, your head posture. The lack of curve in your neck creates tension, right? So the neck curve allows the weight to be evenly distributed. So you've lost our curve, and then the head is forward about an inch. For every inch the head goes forward, the muscles have to double their workload. So if the head weighs about 10 pounds, if it goes forward 1 inch, now your muscles feel like they're holding a 20-pound head. So they're working harder, building up more lactic acid. Like if I have you holding a bowling ball out in front of you, it's harder than if it's close to your body. So our posture determines the mechanical load and stress on the muscles, the discs, the joints. So your alignment hasn't been correct, and then with that, of course, you're going to have tension headaches, cervicogenic headaches, we call them. You keep looking this way. I'm going to have you just look to your left for me. Okay. Any pain when you do that?
No.
Go ahead and look to the right. And a couple things are going on. When you even, so notice your shoulders moving. Watch me. Watch me. Watch me. You're supposed to just watch. See, that was just my neck. Now watch. You can recruit. Do you understand? Your upper back to assist in cervical range of motion. That's what you're doing. So Well, it looks good. I can turn my neck. Yeah, but you're using your upper back to participate. It's okay. Any pain? No pain when you turn?
No.
Okay. Look up for me. Maybe just gently look up at the ceiling. Pain when you look up?
No.
Okay. All right, so your range of motion isn't too bad. You could have part of your neck bending too much and another part of your neck not bending at all. And so your total range of motion looks normal, but it's actually not happening over all the segments too much, as we call it hypermobile. One area is bending too much and another area is hypo. And I'll feel that in a second. You got an injury on the right side that's made your head tilt left, and then you've dropped. Does that make sense? This is what there's an injury on this right side of your neck that we're going to feel in a second. Okay. Oh, I just feel it. Gotcha. Left hip's high. Wow. Left hip's out of alignment. Okay. Let it all go. I got you. Deep breath in. Head down. Exhale. Nothing. Okay. Deep breath in. I got you. Head back. Exhale. Yeah. Okay. See that? Right. Get the idea?
Yeah.
You are way too frozen.
Yes, I feel that.
I got about maybe 4 of the 12 vertebrae in there, about 4 moved.
Okay.
So we don't have our whole team working. I'm going to explain this adjustment and help. So when you're out of town and somebody's doing this to you, the goal of this is to not adjust the injured disc. You have an injured vertebrae, and the injured vertebrae is right here. So you're going to see me do a couple things. We're going to not touch that. We're going to loosen the joint below, called your sacroiliac joint. And we're also going to loosen the joints above. Your lumbar should have a curve in it. So when I'm adjusting you, we want to help encourage that curve to be there. And I'm going to show you how there can be some differences in how this adjustment happens. Some chiropractors are going to want to bring your knee up real high. And you see it when this knee comes up, this flattens. Mm-hmm. What we want to do is we want to have some curve in your back. So come a little closer. And see how I let that curve sway down here? I don't bring the knee up real high. We keep that arched in the lower back. And I'm not going to touch your lower back. We want to work on here and here. Take a deep breath in for me. Exhale for me. Okay, good. Breathe in one more. Exhale. Other side for me. Good. Exhale. 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 All right, good. Hey, something. I got you. I got you, bud. Yeah, right side, right, Alice. Everything's blown out to the right here. All right. There we go. Easy, easy. There you go. You okay, bud?
Yep.
Yeah, okay. I got you. Easy. There you go.
Yeah.
There we go.
Good one.
Has anybody picked on this knot? Are they kind of
No.
No. Okay. All right. It is not minor. It is not small. It is not insignificant. This is a large knot. I'm not a dramatic chiropractor, okay? But I'm going to be a little dramatic when it comes to the size of this. I mean, it is not insignificant and it needs to be addressed. Your neck does not like to bend to the right. Your neck, oh yeah. Oh no. We have a car that is on a level surface and I let go of the steering wheel and the car is pulling to the left, right? It's not driving and tracking straight, and so you're going to wear out one side of your neck faster because the alignment is incorrect. If your alignment of your car's tires is incorrect, your tires will wear out unevenly, and you're not told to call up Michelin and say you got sold a diseased tire, right? The manufacturing of the tire, all of the rubber was the same age, yet the alignment is wrong, and certain stresses are being placed at a higher level on certain areas. Your alignment is incorrect, and then with that, headaches are just an effect of having the wrong alignment. You okay, buddy? Okay?
Yeah.
All right. I'm going too hard, please, but that is a significant knot on the right side of your neck. Oh, you okay? All right. I know. I feel it. Oh man. It might even, give you a headache a little bit as I'm stirring this up and cleaning this out. Sometimes the nerves in here that overlap with the headache nerves are being stimulated, so you gotta work all that out of there. I am a very greedy chiropractor. I have never been accused of going too easy on someone, but if I'm going too easy, let me know. But it's usually Ed, back off, take a break. Yeah. It's like two different, a story of two different necks. See how smooth it is over here? Now, this is going to be the abuse side, specifically this right here. The left lower will be where you essentially abuse. Because you're in right avoidance, you'll be in left abuse, left compensation.
Yeah, I can't even hold the phone on my left side. 'Cause
Correct.
right here starts hurting
Right.
in 5 minutes.
Sure, yeah. You're abusing this now.
Yeah.
So we're into you're old enough that this has been here long enough that now we have the compensatory pain.
Mhm.
We have the original pain, and now we have the compensatory one. Well, essentially, the spinal cord houses the nerves that shut down digestion. We call that the sympathetic system, right? Your fight or flight system. The other system is called your parasympathetic, which is your wine and dine, your rest and digest. So when there's spinal inflammation, these nerves shut down digestion. They'd be the cause of what we call gastric paresis, right? So the paralyzation of your digestive tracts. And so as we would say, stimulate and clean and depressurize the sympathetic nerves, that allows the parasympathetic to do its function and stimulate digestion. That's the story.
Yeah, it's kind of amazing. We never really even learned about the spine at all.
Right.
Throughout school, it's like,
Yeah.
only now I'm learning. I'm like, well, why didn't we know about this?
I asked my wife that kind of question when I was dating her. I was like, because I didn't. I grew up with a chiropractor's father. So
Right.
I did not grow up the way everybody. I'm like, didn't you guys like care about your back? And what'd you say, Carl? And you were like, as long as you didn't break it.
Yeah, I was totally unaware of anything except that you don't want to like get paralyzed.
Right,
basically.
exactly.
As long as you don't break it, but there was no like understanding of discs.
Yeah.
I know. I'm sorry. Nobody showed you that. How did it get so big? Yeah. I use the soft tissue work to help coerce the spine looser so I can get a better adjustment, so we can get a better stretch. It's stretching that changes your alignment, but the stretching is ineffective if your spine's a 2x4. So we have to make your spine supple and willing and malleable enough to accept the stretching. Otherwise, I would just get on QVC and sell stretches, right? Why have an office? You have to prep people for stretching. See all that right there, babe. It's been here long enough that you've got it like wrapped in a ball. It's like been sequestered, and it's almost like it's almost disconnected from the circulation. So we have to like re-hook it up to some power supply. Eventually, no marks come out. The marks are the evidence of what's been congested, clogged, frozen. You know. Here we go. What was your high school, or I don't know, what was your teenage, let's say, sports or athlete?
I did track, so I don't know.
Running?
Yeah,
How many years running?
5 maybe.
Yeah, that's a good. See, you're a better runner with a stiff chest.
Okay.
You're more efficient, you waste less energy, right? You don't need chest mobility to be a great runner. You need your arms moving all over the place and your legs moving all over the place.
Yeah.
But you, if anything, I remember watching a video of Michael Johnson explaining, fast running. You want your chest to be completely locked and your arms to be moving all over the place. And so my point of asking how long you're running is that I want to know how many years you were encouraging your chest to be stiff, right? And I'm not saying you can't run. I'm just saying we have to then participate in keeping your chest mobile, right? There should have been an effort and a conversation, you understand, to understand what the track and field encourages your spine to do, and then be adjusted, stretch, to maintain some balance and limberness in your spine. Without that, that's when this gets beat up. The lower back gets beat up because this is too stiff. Okay. But it's very significant misalignment right here. I mean, Nobody. I can only assume nobody's found this one either. Okay.
No. I can feel it.
I mean, it's huge. I mean, it's not.
My right shoulder's
Look
all
at-
messed up.
It's terrible. I'm sorry you're living with this. Curious exactly the story of understanding how long it's been here. How long have you lived with it?
I don't know really.
We don't feel the parts of our spine that are frozen, so it makes sense that you don't know because, Ed, it's been locked for long enough that I didn't even know it existed until you started pushing on it. But because it doesn't age, there's not necessarily any symptoms for anybody to medically go, okay, let's go investigate it. It doesn't. It's actually younger than you are, and but the very fact that it's younger than you are, that's the problem. It's not aging. And that's a problem. We need to get it to age a little bit more. Okay. Like if I didn't know better, something collided with you in here. Like you fell and it.
I couldn't think of anything.
Something hit this, and then you tilted left to avoid.
Okay.
But this got jammed. Could have been a right rotation, something where these joints got jammed. You got twisted, something twisted you to your torso turned to the right, your hips went left, and this got jammed, and then your body said, ow, and then you healed, tilted left, in avoidance of it, and then that became your new normal. And now because things aren't centered, there's tightness, and like you're saying, your whole body kind of just, like I said earlier, everything just feels off.
Yes.
Right? Because, the whole posture is off. And in order to change anything, we have to first make you supple. You can't reposition hard clay or, hard metal. You have to make everything supple so that it can be realigned. You're not going to see me spend as much time over here because you're so imbalanced that I don't want to make the left side looser because the left side will get looser faster than the right side will get looser. Does that make sense?
Mm-hmm.
So we'll actually further imbalance you. How scary is that, right? If we evenly massage you, we can actually further imbalance you because the loose side gets looser faster than the stiffer side. And so now the contrast between the left and right is actually growing. Now, I'm not saying ignore the left, but we're going to do like 2 rounds on the right and 1 round on the left. And Ed, it's not, you didn't bat, correct. It's not an even, and this is where people can, if you just do massage sometimes, it's like, well, if I loosen you up and then we go sit, I've just enabled you to make your posture worse, right? We want to use that loosening to then aim you into a better position, not sit and round forward and then, does that make sense? You want to try to say?
Yeah.
You can make somebody's posture worse. Even though you're seeking help, we want to use, and so when you're getting worked on it at a deep level, you want to use the time afterwards to aim your spine back to a better position. And there's just not as much to play with over here. The right side has all the goodies. It feels like a young back over here. It's just like night and day. But yeah, feeling all this congested, clogged, whatever you want to call it. Tell people to leave your lower back alone. That L5, it's good that you have that picture because it's a way to, help people that work on you to know to leave it alone, right? Part of you, we have one disc that needs to, like nobody elbows hard down here, ever. Rest of your life. It's like a wound. Let's not poke the wound. But let's, beat up the parts that are not injured. And that's going to give you a long life, long, happy life. And we're going to learn to not chew on that tooth, essentially. You have plenty of other teeth to chew on. Oh, man. you in a second. Everybody at home can see. There it is. Old injury, tightness, congestion. Effects. Right? Everybody's concerned with the effects, but the cause is right here. This is the precipitating injury. If you had Dr. Bo, my father as your father, he wouldn't let this grow. Now, it wouldn't have been fun to have Bo as your father because it would have been, to keep this moving didn't feel good. It felt good to lay in the fetal position on the couch and heel stiff, right? I didn't have a very good, I'm teasing. When I got injured, when I fell off my bicycle, my dad adjusted me and I wasn't allowed to heel in avoidance and I wasn't allowed to heel stiff. Look at all that. Chiro means hand. Chiropractor means hand practitioner. It's supposed to be mechanical, supposed to be hands-on work. I'm not saying left side's perfect. There's definitely some congestion over here, but it's like half or a third the size of the right.
Yeah, I can feel that you're hitting the spots there. It doesn't hurt. It just like it's. Oh yeah, that's right. It's like,
Get out of me. Yeah, we're getting there. When we're stretching in a minute, you're going to feel lopsided on the stretching. It's because your back is lopsided. And as your back becomes more balanced, you understand, it'll feel level. But you'll feel crooked on it when you're not. Well, you are, but it's because your back isn't level. You are on it straight, but because the right side is higher, you'll feel like you're not on it straight. That's kind of one of the first things you'll see as you stretch. That'll go away, that feeling of being lopsided. But that's a significant injury here. This is what's tormenting his lower back, is this being all congested and clogged up here. Oh yeah, that was nice. Nice. Breathe. Yes. Wow, beautiful. We're getting them all here. A little bit there. Yeah, I don't think these joints have moved in a while. I don't think any of these have been part of your team. Relax, I got you, bud. Here we go. It's okay, I got you. Easy, easy. Breathe, I got you. Relax, I got you. I promise I won't drop you. Breathe, exhale. Good, there you go. Relax, relax, exhale. Good, okay, all right. Fair enough. Arms down for me, you okay?
Yeah.
All right, arms down for me. Breathe in for me. Breathe in. Let's go, exhale. Breathe in for me. Exhale. Good, okay, all right, good, okay.
Yeah.
The idea, that's what we're dealing with in there.
Yeah.
That's, the injured disc is way down there, right? The problems are up here.
Okay.
This whole right side, and I was trying to say even in the skin, you know,
Mhm.
your skin's all clear on this side. It's like one guy, and you get a whole, it's not a coincidence that this is where the biggest congestion is on your back. And this is higher. If I took another shot, like more, you'd see this, the one side's like elevated more. I got you. Press back with your elbow into my elbow. Press back here. So you're gonna press backwards into my elbow. It's okay. There you go. There you go. All right, I got you. Good. There we go. Breathe, breathe. Good. Okay. Yeah, if you just put your hand right on your thigh. Just relax there for a second. So you check your ears, okay?
Mhm.
Do some ear checking, okay. All right, go ahead and tilt your head to the left. Go ahead and tilt left. Okay, good. Okay. All right, go ahead and tilt right. Okay, nothing. Just that one on the side, I think. Go ahead and tilt. A little bit. You're a good sport. Lean back for me. Go. Okay, good. Lean back. Good. Okay. Can't let you. He didn't check my toes. I tell my wife, I always go for chief complaints. Do you understand? I want to spend 90% of our time on what he put on that. And that's why the first thing I looked on your paperwork was neck pain. I'm like, oh, I got a picture of his lower back. I'm like, where's his neck MRI? Now, if you told me on your chief complaint, toe pain, then I'm spending my whole visit on your toe. Well, your lower back, but
Yeah, there's a lot
Yeah, I'm
of problems here.
It's okay. Tackle them.
all right. There we go. Okay, good. All right, good.
Yeah, I've been watching your face.
How you been using it?
So I go right about there. Which
And does this cause a headache when you're using it?
one? No.
How do you feel generally when you get, does your back of your neck go warm or tingly after you get off?
Yeah. Yeah,
How
the
much
blood
time are
rushes
you-
back, but
How much time are you able to lay on it? How long have
I
you
can
been-
do 20 minutes, yeah.
Okay.
And how many times have you done 20 minutes?
I did it for a month straight, every
Straight.
day.
Okay.
So a couple things, I mean, obviously, it's meant to be used in conjunction with care. The purpose of
Right.
that is so that you can do it effectively. What happens is if your neck is as tight as I felt earlier, the effectiveness of the Denerol is limited by your neck's flexibility to go over the device, right?
Right.
So I would hope that as you continue to use it now, it'll be more effective and it actually can help restore that curve more than what you've been using it for. I want to check you again on the neck adjustment. We'll try to adjust that right side, but there's a lot of fluid on that right side. I would actually do a little bit of right rotation.
Okay.
So while you're on it, about 10, 15 degrees to the right, and then a little bit lower, and you push and you turn, and you kind of work that right side of your neck to get some extra pressure on the right. I would do that for about 1 month. I wouldn't do more than a month unless somebody's reevaluating and checking, because it will level out. But with how significant the right misalignment is, I would have you over to the right for about 1 month, 20 minutes, and then we talk. 20 minute sessions.
He's got it then in a good.
It looks good, yeah. I would
Did
maybe
a
have a
good job.
little bit lower, just enough that the biggest thing I'm seeing is that your head really isn't sinking in
Mm-hmm.
as deep as it should for it to be very effective.
Okay.
And that has to do with table work. It's prep. That's why I'm just, I can't mass sell. Otherwise I would close my office and just sell Denerols, right? But the effectiveness of the tool is limited based on how well your upper neck. Your total is what's deceiving with your neck is that your total range of motion is actually fine, but I suspect it's happening too much in that lower neck where the disc is injured, and it's not happening in your upper neck. So when you're laying on the dental roll, the probability that you're only bending where you're loose is high. And so we got to be a little careful. This is where there are some chiropractors that will actually image you when you're on the dental roll. You understand, to see how your neck is doing. I don't have that capability, but there are other chiropractic biophysics guys that would actually lay you on the dental roll and see how it looks when you understand, they'll x-ray you on the dental roll. I suspect now it's actually doing what it's supposed to be doing, but before, if your neck was stiff, it might be bending too much in the lower neck, and then you end up maybe aggravating the lower neck. That's why you need to be adjusted so that the tool can be used the way it's supposed to. So it's tough. We call them cervicogenic. So there's on the right side of your neck, there's a large amount of inflammation. The first phase of care is to clean out that tissue so that the nerves are residing in. Now, the reason why all that tension and lactic acid builds up is because of the alignment, the mobility. So just gua shaing it, cupping it, same category, is temporary in its effectiveness. We need to actually get the curve back in your neck. And in order for the curve to quickly come back to your neck has to be supple. A little bit. You can even let it slide down a little bit more than where it was, and then let me press. Get your head to really.
Yeah.
So maybe you're a little high, I would say. So, which is okay because we know there's that C5 disc injury, so we want to keep it as high as we can, but your head still goes over it. But I don't want to loosen the disc injury anymore, so we are threading a needle here a little bit. That disc will rehydrate and stop bulging the more we rehabilitate. We call this extension traction is what this is called, or mirror image stretching. So we're actually decompressing the front part, which then shifts the disc away from the spinal cord in the posterior compartment. Okay. So 20 minutes. You don't lift your head up off it. Use one hand to lift, grab, lay your head back down. That's the main thing is when you get off, don't just, use your muscles to get you off. Is that MRI after you did the month sessions, or?
Yes.
That MRI was after a month of doing the dental roll?
Yes.
Wow, so it was worse than. If you do a month of that, it's gonna, so you've actually, so that anterior, that retroesthesis that I'm saying would have been worse. You're saying you've actually stretched some of that back into place by mastering this. So this is really more for kids. Oh no, I got you, bud. Okay, here we go. Now you're on the big boy.
Oh yeah. Yeah, that is higher.
Yeah. This is what you should be mastering. It's okay. But typically I would do at least 3 months. It's fine to spend a few months on the smaller guy, acclimate. Would anything get worse down your leg while you were on the dental roll?
No.
Would it feel better? If you had symptoms, would they feel better after you got off the dental roll? Describe kind of the journey.
Maybe a little bit. I don't know.
So you noticed kind of not much difference.
Right.
So I'd be, like I said, part of me was, at least for the lumbar, you need to be on the bigger one, so first of all.
Okay.
The worry that I have primarily with people just doing dental rolls without being adjusted is that you're highly likely to just bend where you're loose, which can further imbalance your spine. And I'm wondering how much of that might be going on. I mean, you're definitely decompressing the front, but what happens is if you bend too much at the bottom, you end up hypermobilizing what's already loose. Your chest is definitely stiff. So, it's a concern that I would have. I usually spend 3 to 5 visits, beat people up before I even throw them on dental rolls. So I would recommend, you can go higher on this. This would be the lowest position you'd be on it.
Okay.
You can go below your shoulder blades a little higher, but the whole chest area can be involved a little bit too. It looks good. You can do the knee side to side.
I was doing that, yeah. When I first did it, I couldn't go anywhere. I was like, oh.
Okay, so you've progressed a little deeper with the...
Yeah.
Show me.
All right.
I know it's on the bigger one, but show me, yeah. Beautiful. Try putting the arms to the side. Eventually, you have to bring the arm up on the right. Bring the arm up like almost there. Yeah. And eventually, you have the arms over your head, too. You can work all these angles. Yeah. Beautiful.
Okay, and I've been using the foam roller with the arms up too.
Good. Yeah, you're ready. You're ready, I think.
Okay.
Arms up. There you go. Yeah. Up there where that shoulder knots are. And
Yeah.
so I want all of that to be, you need to re-recruit and, loosen all of the vertebrae. So knees to the right should be worse. Go knees right. Then you're going to compress that. Yeah, right there. Yeah, compress that right side.
Yeah, it's.
And this should be easier. Yeah, that should be easier. So I'd almost want you going 2 times to the right for every 1 left.
Okay.
Right? You really want to. You almost don't go. I almost would fast from going left. I would just go right for like a month. People ask me all the time. People do circles with their neck. You end up just grinding your lower neck more. Most people's lower necks are very loose. The upper necks are tight.
Yeah.
So if you do a roll if you're in a circle with your neck, you're just pivoting primarily on your lower neck, further stressing what's already injured. So do I advise people to do neck rolls, circles with their neck? No. I want people to master the denturals. You're saying master getting adjusted and live a long life. Any physical activity is just going to take whatever's working and make it work, right? And so how can I isolate the parts that need to be encouraged to be loosened and not further stress the parts that are already stressed? And I don't know how I can do that just actively. It has to be done kind of passively with either somebody like me working on your back or a stretch harnessed and focused into certain areas.
Yeah.
Let me have your head. I got your head. There it is, a little bit. Yep.
Yeah.
Yeah.
Crunchy.
Yeah, you're ready for dental now. You're saying it's just you got to get all that. It's the principle in an engine is that water doesn't compress, right? If water gets in your engine, it'll blow your engine up because water can't be compressed. So the synovial joint capsule is filled with water. So it has to be like excavated and evicted from the joint capsule by squeezing it out.
Mm-hmm.
That's part of what the adjustment does. You understand? But they both work hand in hand. You got to compress the joint as much as it can be compressed, and then you have to like squeeze it out. Then you have to adjust and then squeeze. You understand? To get the joints to overlap, so we actually can stretch deep enough to get to the ligaments.
Okay.
And without the adjustment, we're not going to get deep enough to that ligament. So you're not going to. That's why I have to have a chiropractor. When you're sitting in the airport and all that, I want you to put something behind that middle back. Don't be sitting unsupported.
Put some behind the middle back.
Anything, a water bottle, just
Okay.
right contacting here.
Okay.
Right in that middle back. Is I want pressure, and if you get it more on the right, it'd be even better. But
Okay.
just up here, we need to change the folding point. So imagine a piece of paper that you keep folding back and forth in the same crease, right? It starts to tear.
Yeah.
We're trying to create a new fold where it isn't injured, and you're primarily folding right at that. Like if we took a motion picture of your lumbar, we'd see that most of the mechanical bending is happening right on that L5 disc, on that last disc. And then the nerves that come out of there are agitated, which then goes to your leg, and that's why your legs feel shaky. You have a wound.
Mm-hmm.
Think of that lower back disc injury as a wound, and so this butterfly stitches and it mobilizes it, right? And that should, especially when you're standing or moving around, you don't want to be using this when you're sitting, because then it constipates you and it stiffens you all up. But when you're moving around, because you got this all stiff and now this is forced to become the loosest, right? When you sit, you need to actually have something behind your back.
Okay.
Like you could even use your lumbar dental at work. You could, use this in a chair. Putting that makes sense, behind your back, higher up here, and you lean back. But you shouldn't be allowed to just round,
Right.
because that's then gonna throw all the work down to your lower back. And the leg shaking, that's all, you have a significant disc injury. And I'm sorry that no one said that that's significant, because it's extremely significant. And, that's a tough story, that they're selling you that, no, you're fine, you're not.
Yeah. Sounds good. Thank you, sir.
All right, so basically it is killing me. It feels like there's a knife stuck through me, basically. So I mean, like I do feel it in the front, but it is mostly like basically where my fingers can barely reach is where I feel it. Yeah, like right there. Yeah.
Not
Yeah.
lateral, like I said earlier, not so much out here a little
It
bit.
can be. I can feel pain over there too, but it is 100% like 24/7. I do feel pain there. Basically I was on this incline bench press sort of thing, so I was really only sitting back about like 15 degrees.
Yeah.
But I was like pushing weights away from me at an angle, and I heard this, and it was like immediately painful. And like I had to stop like right there, and I was like, man, you know, maybe I should go to the hospital or something. Like I didn't know what happened, but like, you know,
How long ago was that event?
it was about 8 years ago.
Okay. So the difficulty is, you know, and so you've been going through some chiropractic care. They've worked a lot on that area, a little bit better, but overall not getting where you need to be.
If I'm lucky if I can get that. It feels like my rib head is out of place. If I can get it back in place for like a couple hours, like once a month, that's a good day. You know, just for that one day. But the rest of the time, 99% of the time, it is not in place.
And you've been through a lot of care on that area. They've taken images of that area. Nothing they can see on imaging.
Nobody sees anything.
Nothing's
like,
on there.
You know.
But nobody. And I asked you earlier, and I know you said they haven't. Nobody's taken any pictures of your neck. No MRIs of your neck that you can recall.
I mean, I think we might have done a few full body MRIs, but like, you know, nobody like pointed out anything. Yeah, nobody pointed out anything in particular that was out of the ordinary. So
there's a thing what we call referral pain. So in the 50s, they took salt, and I described it to you earlier. They took some salt and they injected it at every nerve root, and they basically, you know, chiropractic started in 1895, but we didn't have the wiring diagram until the 1950s. Knowing that when you inject a nerve irritant in the lower back, patients experience pain in their foot. And if you injected salt in the upper cervical, you didn't really feel it where they injected it. They felt it here on their head. And if they inject T10, you'd feel it along the rib. Does that make sense?
Okay.
And if you inject the lower neck, they would feel it exactly where you're describing, right in between the shoulder blade. We call this referral pain, and Carl, you can kind of briefly look at that poster over there where the lower neck joints refer pain to that whole area, but very commonly, specifically, it'll be described very similar to how you're describing it, which is right there.
Yeah.
And so if it is a rib, and at the same time when you were doing this activity, there's a lot of stress on your neck.
That's a good point.
Right,
yeah.
A lot of stress is going on your neck at that point. And so what I'm going to do today, I want to try to see if I can take some stress off your lower neck, see how your body responds, loosen up the upper neck, loosen up their back. And if it is a rib, I'm going to clean it out. I'm going to dig it in there. We'll Gua Sha. If it's something that's actually there. But because of the amount of care you've had on that area, and the neck hasn't been addressed as much, I feel that I think we need to work on that neck. And has anybody mentioned curve in your neck at all? Has anybody mentioned?
Yeah, I mean, a few people have a few times. Yeah.
Have they given a plan for how to bring the curve back, and not so much?
Yeah, I mean, they've recommended the different like products that you can use to
stretching.
Yeah.
Okay. You have some sinus issues also a little bit. Is that just today or?
No, I mean, like I've had this problem with my right nostril, and I've got to tell you too. I had a doctor put some shots in that area.
Is it more on the right side?
It's absolutely on the right side, 100%. Yeah.
You understand that's not coincidental that you have symptoms on the right shoulder blade.
Yeah.
And that the whole right side of your neck can be inflamed.
Yeah.
The drain lines, for instance, of the sinuses all drain down the neck.
Okay.
And so what essentially nasal drip and overflowing maxillary sinuses are, it's not draining internally the way it's supposed to, and so it's overflowing out the top. And so forward head posture plays into this. The more forward the head goes, the tighter the muscles get in the neck, and that crimps the drain lines that then cause sinus issues and infections and ear issues, all these things.
Yeah, what about like tinnitus? Because like I had a doctor put some shots on my back, and after the second shot, it was like a series of 3 shots. After that second shot, I had tinnitus ever since then. And it's primarily in my right ear.
Yeah.
It'll occasionally travel over, but like, same thing with sciatica. I have sciatica primarily in my right side. It'll occasionally travel over, but it's 99% of the time it's usually on my right side.
I usually find that there's compensatory problems. So one side is stiff, another side's abused. So you're going to have one, and you might even see me working on the left side a lot today, and you might be going, Doc, it's over here. Why?
I understand, yeah.
Because generally you have an area that's underworking and an area that's overworking, and we hurt in the areas that are overworking. So we want to find where is the part of the spine that's not doing what it's supposed to be doing to take the stress off the areas that are abused. The right lower back is mainly controlled by your middle back. They're connected to the neck in the sense that the more forward your head goes, the tighter your middle back becomes. So the tighter your middle back becomes, the more we overstress our lower back. That lumbar curve that's supposed to be there, when that curve goes straight, all the weight like a ladder goes right to the lower back. And like I said, with that SALT study, if they inject the lower back, they get pain in the foot. All right, so we're dealing, here's your shoulders, middle of the shoulder here. ear hole, those should line up from the side. And the more forward your head goes, the more mechanical stress is put on the discs. The discs are a tough structure to understand because they don't have feeling. I can't ask you on a scale of 1 to 10, tell me how your lower cervical discs feel. They don't have sensation. What we can feel is the joints and those nerves that exit the side of the spine. So when the joints are inflamed or that disc hits the nerve, you're going to get symptoms in locations other than where the disc and joint primarily are. All right, so we got some shoulder tilting. Your body is in what we call compensation.
Sure.
The compensations aren't the problem. They're the result of a problem. Everybody will look at the compensations and try to change them. It's like, well, no, if your body's tilted, it's because you're getting away from something. How do you stop tilting? You get rid of the reason for why the tilting's occurring, right? I don't blame you for tilting. If I break my right ankle, I'm gonna tilt.
Yeah.
Feet together if you can. Feet together. There you go. Take a deep breath in for me. Listen up. I want you to let all the air out. Keep going. Yeah, real tight there. I got you, bud. Let it go. Let it go. I got you, bud. There we go. Deep breath in. I got you. 2 more. Let it go. You're totally frozen. Okay. I'm learning you. Exhale. Chin down a little bit. Yeah, totally frozen. Okay. All right. Yeah, we got work to do. The mobility of your upper back plays into abuse of your lower neck. Do you see how if the upper back is tight and your upper neck is tight, do you see how the lower neck is left doing all the work? So, that is going to cause inflammation buildup in your upper back. And I'm going to clean out, like I said earlier, your upper back also, but it shows me that your lower neck's in a lot of distress.
Yeah.
And we gotta see if we can fix that. All right, I got your head. There we go. Let the side go right here. Let it go. There you go. Okay. You want to have this upper neck. Let it go. Chin up. Okay. All right.
Wow.
60% of the work of your neck is designed to happen right where I just adjusted you. It's not an even distribution of work in terms of the cervical area. Most of the other spine has an even distribution of work, but the cervical spine, the top 2 vertebrae, do 60% of the work, and then the 5 rest of the vertebrae do 40%. Does that make sense? Mm-hmm. So if you don't have the upper cervical working, then the lower neck is going to be under a lot of extra stress and doing work that it wasn't meant to mechanically handle. And then when you overstress the lower neck, you're going to feel it elsewhere. And so let's see if we can move some stress back up to the upper neck. We find that there are 24 vertebrae, 23 discs. 5 discs have all surgery. The lower neck and the lower back, 99% of the time, that's where all disc injury happens. And so I want to be careful to not further stress out those areas that we already know disproportionately have a large percentage of disc injury, right? And the idea of the word adjustment is to focus, movement into the areas that are stiff, to adjust them, to bring them back online, and to not adjust and loosen the parts that are already injured and loose, right? That way that we actually bring the spine into balance. It's like something from Star Wars. Bring balance to the force. Bring balance to the spine. Yeah, I got a clog all up here in the upper neck here. You can feel all these little lymph nodes.
I'm absolutely feeling that. I was just thinking about that.
Mm-hmm. This is the drainage of your sinuses, your ear, tinnitus, all of that.
Really? It's amazing.
That all has to be... the mobility of the tissue is what washes the tissue, right? So when an area gets stiff and tight, it prevents it from mechanically draining. The lymphatics are your sewer pipes. They drain the sinuses. It's not supposed to have to come up overflowing out the top. the curve in your neck maintains the suppleness. When we lose the curve, when your head goes forward, that's what introduces us all these problems into our spine. And we don't live in a world of very many orthodontists, very many postural guys, and if your spine's not supple, even the stretches won't work. So we have to, like clay, you can't reshape hard clay. So if you put hard clay into a mold, it won't do anything. You have to first kind of make it all soft and flexible so that it can be reshaped. Right. When I looked at your back earlier, the left side of your back is more elevated. This the highest subluxated or highest misaligned spot is right here. Feel that knot right there?
Mm-hmm.
It doesn't exist on your right side. This is the culprit for the right leg sciatica. This is an injury, kind of a tear that then healed with a ball of yarn right here. And if we don't clear this, the right side abuse will not stop. This has to be. And I can only imagine nobody's found this, right? Is that correct?
Right,
okay.
yeah.
Nobody sat here and dug and showed you that there's a blockage on your left side. The right side is the compensation. It's just the abuse as a result of this. You almost can name this thing. I mean, it's. Feel that, right?
Mm-hmm.
That knot should not be there. The original tissue was organized like railroad tracks. They slid together very easily, and then it got injured and it tore and healed like headphone cables into a knot. And now you have to sit here and brush it, comb it until the comb can go through the tissue effortlessly. It shouldn't get snagged. Yeah, a nice knot even on the left side up here. Just
I'm ticklish. Second it for you.
Okay, all right. This is the whole. All of this is the cause of the right leg sciatica. There is not much function right here. Gee whiz, look at that knot. The idea with some of these orthotics is to emulate my elbow. They'll actually be used to copy this as much as possible, and you can actually use the Denerol to put pressure here to give you some semblance of, ability to care for yourself at home and not have to constantly have somebody like me or, somebody to push in here, and that we can teach you to do it home care in that sense. And this is where we're going to be targeting. We got to target that. Need a little gristle right there. A little.
Where you're at right now. That's where I feel it. It's hurt about.
he was saying your back is just totally swollen, frozen.
Yeah. Gotta unlock it first.
Is that consistent with what other chiros have found? Just real stiff, or they tell you? You remember?
Yeah, you know, but they don't put the elbow grease into it like this guy does.
It's like a bolt that's not turning. You know, if it doesn't turn, you don't just give up. You put some penetrating oil on the threads and see if you can, you know, soak the threads and then give it another shot
Exactly.
with a bigger breaker bar. And somebody's got to get these bolts turning. They're just joints. They're designed to move, and they're frozen, and well, it's going to cause problems. Whew. Oh, here it comes. Yeah, here it comes pouring out of here. Jeez, there's the knot I was talking about. See how it's pouring out of that spot, right? That's the epicenter. Yeah, I've gua sha'd you evenly pretty much everywhere. You understand? And when you look at the video and later, you'll see that not a little bit came out around it, but where internally there's the most blockage is where the mark will be the darkest.
Gotcha.
And the care eventually leads to a place where no mark comes out anywhere. The skin just becomes kind of flushed looking, and you don't ever get this like dark reddening. That's the Sha, they termed it. That's what's internally the blockages, the inflammation. And like I expected, the abused side actually gets plenty of blood flow. You understand? Or more blood flow than the stiff side. You understand?
Yeah.
Because it's abused. It's getting, you know, blood. The side that's stiff and stuck and tight, and that's the side that doesn't get much circulation. So the most Sha mark comes out not where it's abused, it comes out where it's stuck. Right? Now I'm trying on the right here. I mean, there's some, but there's not nearly as much as what came out on the left. Right here is where the darkest. I just love the term Sha because they call it like, which means like ghost, like a bad energy. You know, it's lactic acid. It's just injury, inflammation, whatever you want, cytokines, interleukins, whatever you want to call it. But it's chemical intermediates that then irritate nerves and get trapped in the tissue due to injury and posture. And yes. Nice. So there's a thoracic den roll I'm going to show you in a second. The idea of the den roll is to emulate what I'm doing right here, to get not only inward pressure, but also downward pressure to fold these vertebrae closed, you know, and reduce the hump, reduce the kyphosis that happens when our head goes forward. This starts to elevate the roots of the neck, attaching the shoulder blades here, stiffen the back. Lift your head forward. Put your forehead right there on your forearms. Forehead on your forearms. Perfect. You got it. Okay. And there you go. Just relax your back. Relax your chest. I got you, bud. We're going to lift up a little bit. Here we go. Breathe. All right. Breathe. Relax. Relax your back. Exhale. Come on, bud. There we go. Breathe for me, bud. Exhale. Breathe for me. Exhale. Wow, yeah, wow. All right, good. Arms down for me. Breathe. Okay, good, okay. Maybe go on your back for me.
Okay.
There we go, nice. No, okay. Just checking. Good, okay. I would work this spot right here. The tighter this gets, the more stress the knee gets in like a torque fashion. This is what causes foot flare. You know, your toes will point outwards. The tighter this gets, the more stress goes on the medial meniscus. You want to stretch the quad. The goal being that you get your foot up on the table. Does that make sense? Get the idea? You want to work on this guy with the toes pointed. Does that make sense? Perfect, just like that. Get the idea?
Yeah.
You know, you want to master until your knee can touch the ground. You understand? That's what you want to work on,
Oh, goodness. Wow.
is mastering that
Okay.
to the point where it's just a joke.
Yeah.
I believe that the more you stretch this out, now, see how this tightness here is
Yeah.
what I'm trying to work on by doing the quad stretch that you're doing.
Okay.
You want to do that with the goal of getting rid of this knot
Yikes. Yeah.
on the inside of your thigh here. Right there. There's a lot less knot over here.
Yeah. Because I mean, I don't accelerate with that foot. You know.
All right. Take a deep breath in. Exhale. I got you. Not gonna fall. Nobody falls. Nobody falls. I got you. Breathe. Let it go. Okay. Other side for me. Other side. That's good. Maybe sit for me, facing my wife. Press back. There we go. Okay, okay. Check and see these guys. There we go, yeah.
Yeah.
Okay. Go ahead and tilt your head to the right for me. Tilt right.
Oh wow.
Oh, wow.
All right, go ahead. Tilt.
Oh my god. Now I see why everybody has that reaction on YouTube.
All right. Go ahead and tilt. One second. He's off to the races.
I can't wait.
One second. Left.
Oh yeah.
Oh, man,
That was
right
awesome.
side.
That was amazing.
Go ahead, tilt left. Yeah.
That's deep.
That was stuck. That
That was-
bottom one was.
I know because I
Oh.
felt it forever.
Oh.
I'm sorry, I didn't mean to spit all over you, but
No, you're
yeah,
fine.
I
You're
felt
fine.
it forever though. Forever. I've always known there's something wrong.
Something's clogged in there.
Yeah.
Yeah. Let me show you the picture of your back here real quick.
Wow.
I mean, that's a lot.
Yeah. I didn't expect that much inflammation on the left side.
But like I said, this is the sciatica. Your sciatica is from mainly that guy right there
Really?
is what's
Wow.
causing your. I mean, there's some
I
on the
would have
right.
never
there's,
imagined.
There's some on the right, but
Yeah.
it's a lot darker.
That's crazy to me.
And then that's the spot. That's what you're pointing to.
Okay.
So my point is that we want to. There's definitely a blockage, and we're going to stretch a little bit. I'm going to try to adjust it again.
Okay.
You know, it's frozen. It needs a couple hours of care to unlock that area.
I believe it.
And then you can see in the neck there,
Yeah.
there's blockages on both sides of the upper neck. You mentioned earlier you have you done anything similar to what you're laying on right now? Have they put you on a device that's arching you back like this?
No,
Not so much.
not really.
Not really?
No.
Okay. The goal is 20 minutes. In order for a change to be enacted, we have to hold this for 20 minutes. The ligaments that define your posture, that wrap your spine, will not change in 2 minutes or 5 minutes or 10 minutes. They have to be held for about 20 minutes meaning when you come up, you're in a different place, that you're actually in a different posture. And that took till like the mid-90s to figure that out. So chiropractic started in 1895. They didn't figure out till the mid-1990s that you have to stretch to change posture. Chiropractors still we're teaching that adjustments change posture. That me adjusting you is gonna bring your head back. Does that make sense?
Mm-hmm.
And I'm here to tell you that's not true. You can't change posture through adjustments, but adjustments are necessary to make the spine supple and willing to accept stretching. Makes sense? So they have to go together, but it isn't, other than perhaps for 30 seconds or 20 seconds, posture might change through an adjustment, but you're not changing the ligament length, the ligament laxity, the tightness of the rubber bands. The ligaments on the front are all tight. We have to stretch out the front, compress the back. Get the idea?
Yeah.
And ultimately, the idea would then be to put this strap on your forehead and pull. Get the idea? You then pull the neck in. Don't necessarily want to do that the first time we do it, but okay.
Does he need a block or anything?
How's your neck doing? You okay?
Yeah.
If anything starts going tingly down your arms, we can put a block behind your neck to reduce the depth a little bit. But
You said this. How would this feel?
well, the idea of this strap is that it actually goes on your forehead.
I'd be okay with that.
It pulls.
I really would.
I have not seen many people who even want to do this. That's fun.
Oh yeah, that's awesome. I love that.
You just want to be this device is meant to be used under chiropractic supervision. So there are other nerdy chiropractors like me that call it chiropractic biophysics, idealspine.com. I'd be happy to let you lay on the the yellow guy without as much care, but when you're doing the bungee strap, you just got to make sure the whole spine's working as a team. The neck, it's meant to be used with neck adjustments.
Yeah.
That's good. Wait. Leg straight for this one if you can. There you go. The idea is to have it in the middle upper neck, so it will have a tendency to want to slide down to your lower neck where it's looser. We want to try to be as vigilant as possible about keeping it in the upper neck. You'll take your hand, place it on your forehead, you'll press, get your head to sink into it, and then you put your hand back down to the side or wherever you want to put it. And then 20 minutes, same principle. Keep these arms crossed, push again. There we go. Take a deep breath in. Exhale. Yeah, one more. That was a deep one.
Yeah.
Let it go. All I got, bud. Just that one more shot. See if it's any more. There you go.
That's awesome.
You're breathing hard.
I'm going to take a nap. Come up see how that feels. Yeah. See how that feels. How's that doing?
It feels good.
A little looser?
Yeah.
Yeah. Yeah, it's master of time. You gotta get on those stretches.
Yeah.
Work on keeping that head back. As much as possible throughout our life. Try to avoid, that
Text neck.
forward neck and the text neck. The anchors of the neck are right down there also.
Mm-hmm.
So as the head goes forward, this all pops up. So as much as possible, keeping that chin, not tucking it to your chest is a part of your care.
Okay. Thank you.
Pleasure, my friend. Yes, sir. Thank
I
you.
appreciate it.
You did great.
Thank you.